These last 2 years have tested not just our healthcare response, but also our social bonds and our political will. I'm grateful that in a crunch, Singaporeans have stayed united, worked closely with the government, and come together to support one another. Overall, we've come a long way. We've made a lot of progress, but we must still be prepared for more bumps along the road. Right now, a new variant of concern is emerging. We learned a new word, the Omicron variant. We're tracking this very closely. We're not sure yet, but we may well be forced to take a few steps back before we can take more steps forward. But despite all this, I'm confident that we'll find our way to living with the virus and safely resume all the things that we love to do. We are making all this effort because we want to get there safely with as few casualties along the way as possible. Every crisis is a test of trust. In a public health crisis like COVID-19, we all rely on trusted sources to explain things to us and to advise us what we need to do. Most of us are not doctors and scientists, and even doctors and scientists have difficulty keeping up with a flood of new knowledge, science about the virus, how it behaves, how to treat it, what is likely to happen next. So people look to the government to assess the situation, judge what to do, and organize a national response. The whole country must work as one, but it's a government that must decide what to do and lead the country forward. One big reason our measures against COVID-19 are working is because Singaporeans trust the PAP government. They trust that the PAP government will keep everyone safe and keep Singapore in working order. That if people catch COVID-19, they'll get proper medical treatment. That if we have a lockdown, affected workers and businesses will be taken care of. That supermarkets will be stocked and essential services will not be disrupted. Singaporeans have this confidence because for 60 years now, we've had consistent, functioning, good PAP government. They know the PAP will never give up in a crisis. We won't buckle. We'll always have your back. So as a result, Singaporeans patiently complied with burdensome safe management measures and repeated rounds of tightening and then easing, and then tightening again, and then easing again. They accepted that the tightenings were essential to slow down infections at critical moments and prevent our healthcare system from being overwhelmed. They understood that the changes in plans were hard to avoid because in a rapidly changing situation, we have to adapt our response as the situation unfolds. I'm very glad that everyone came together, accepted the inconveniences and hardships, and made our measures work. Thank you, everybody. When vaccines became available, Singaporeans came forward to get their vaccinations without any hesitation. It's been a very successful campaign to vaccinate everyone. Today, 87% of the population is fully vaccinated, probably one of the highest vaccination rates anywhere in the world. And it's not just because the vaccination campaign was well organized or because the vaccinations were for free. In fact, in some vaccination centers, you've got goodie bags. it was also because people trusted the government, trusted the healthcare system, and accepted advice to get vaccinated to protect yourself, to protect your families. Elsewhere, the situation is often quite different. Some countries have had great difficulties vaccinating their whole population. Europe is now struggling with a fourth wave of infections. Vaccines are readily available, but a significant minority in every country simply refuse to get vaccinated. Many of them are anti-vaxxers, not just because they are misguided or ignorant, but because of deep distrust of authority in general and of their own governments in particular. So when the governments try to persuade them to get vaccinated, their response is, "I don't trust you. Why should I believe you? Why should I listen to you?" That's in Europe, but it's also a very big problem in the US. Their attitudes towards vaccination split along partisan political lines between the blue camp, the Democrats, and the red camps, the Republicans. The Democrat supporters are eager to get jabbed and willing to wear masks to protect themselves and others. But many Republicans still remain unvaccinated. Even in red states, meaning states which vote Republican, red states where they're having new outbreaks, many people seriously ill, large numbers in ICU, and dying. And this is weird because the previous Republican administration was the one who pushed to get vaccines invented, tested, confirmed, deployed, and now Republicans don't want it. But essentially, it's because the Americans are profoundly divided, because the public health care is politicized, and on top of that, there's deep suspicion of the government. These political divisions and social distrust have made it harder for the US and European countries to bring COVID-19 under control. In Singapore, we are very fortunate. We have not had such divisions in our society. But remember, we did not become a cohesive, trusting society overnight. Social cohesion is a work of decades. And trust had to be built up long before the crisis. When a crisis strikes, if the trust is not already there, then it's already too late. I'm very grateful that the PAP government enjoys the public's trust, built up over years of working closely with Singaporeans. We've been delivering faithfully on promises. We've been consistently producing results for people: housing, healthcare, well-paying jobs, better lives. We've shown year in, year out, in good times and bad, in crisis after crisis, that the PAP government will always be there, with you, for Singapore.